My name is Amy Macechko. I am the Health and Wellness Coordinator for Talawanda School District. And in that position, also have the privilege of serving as the project coordinator for the Coalition for a Healthy Community here in the Oxford area.
My name is Rebecca Baudry Young, and I am the director for the Office of Student Wellness at Miami University in Oxford, Ohio. I serve on the leadership team for the coalition, and I also chair the Alcohol and Other Drug Work Group, which is a subgroup of our coalition. We first really looked at partnerships, and I think that was the beginnings of identifying what working with and working for was going to look like. And so many of our partnerships were, we want to do this, you want to do this, let's work together and do it. And that's was working for us, and that was beneficial to our community. But we started to evolve, and I'll let Amy maybe talk a little bit about when the light bulb went off and we realized that working with and working for were very different.
Absolutely. So, one of the things that I think that light bulb moment, we really started asking ourselves, we may have access to data from multiple community sources that say there is a need, right? But we also recognize that, the community perception, community readiness also have to be taken into account before a coalition can mobilize to address an issue. And so if the community perception is very different than what the coalition folks think is the need, and that mismatch doesn't always can I would say lead to more of a working for versus a working with. And so on several instances, like Rebecca said, just partnerships and things like that. But where we really, I feel like, made that shift were a couple case studies that we have here to share where, for example, we serve 144 square miles that make up our Talawanda School District. So we have the city of Oxford with the home of Miami University right in the center, and then we have 4 very rural township communities. And based upon access and personnel, for the first part of our existence, very city-centric. Right? Because it was easy to access folks within the city, but we really have been intentional and looking at onboarding coalition members that represent those township areas. Well, we were much excited and surprised when residents and township trustees from the community of Riley approached the coalition and said, hey, we've got some issues around this open green space behind our community center. We want, and they started listing off things, and we're like, thank you for coming to us. What are the rest of the residents have to say? Could we partner and host a community listening session? But it was their invitation to come that was really exciting for us and kind of opened that door to really working with. And so we hosted a community listening session and found really valid, real concerns about a lack of physical activity space and safe areas for kids to engage in physical activity. And so we worked with the trustees to develop a plan to do fundraising. New partnerships came about, everything from alumni of the old Riley School to the Cincinnati Reds Community Fund actually participated in helping us to renovate some baseball and softball fields in the community. And we had policy changes around e-cigarette use and tobacco use, and it was very much the result of that trust that was being developed, and the fact that we weren't coming in saying this is what you have to do, but what is it we can do to convene people, to help secure some resources, to build a healthier community within Riley Township. So that was a really kind of a starting point, I would say, for us, and really had us start looking at parks in a new way within our greater service area. But then I think the real leap of faith into working with took place when we began to work with our HUD housing community here in the city of Oxford limits. And it's a community that we did have data that suggested there were needs. But it was also something that we didn't have relationships with folks. We didn't know what their perception of the needs were. And so what we did, and we are very grateful to Epiphany Community Services, they helped serve as a facilitator for an initial listening session where we invited residents from this community to come to our local elementary school, which is literally like a parking lot away, and talk to us. And we took it from a very asset-based framework, right? We didn't want to focus on the deficits, but rather what's here that we can build upon. And we had attendance there that just really excited us, and folks sharing with us, pouring their heart out about the things. And we really heard an overall theme that folks just did not feel like they had a voice in our community. They were feeling hidden, ignored, and they were craving consistency and opportunities to work with partners that weren't just going to be a one and done. They shared that, people come in and try to do things and then we never see them again. And that's not what we want. We want community helpers who are in it for the long haul, who want to build relationships with us and want to listen and not just make assumptions about what we need. And so that was huge. And we did identify some major needs in the areas of safety, maintenance issues, programming. And so we kind of went back to management and prepared and shared, and some immediate changes took place, which really sparked some excitement with the residents, like we were heard, right? And then reporting out to the residents that, like, this is what we heard you say, is this right? Because again, we don't want to make assumptions, or it's easy to put things into your own words or language that fits with the context in which you hear it to be. But when residents said that, yes, we want to come together on a regular basis, we want to be actively involved and work with you, and the exact phrase was to create a more harmonious and safer, healthier community. Wow, right? The residents said that. It wasn't us saying this is what you need. And that has made all the difference. Since then, we have formed a resident council, and there is membership in this council where they get together on a regular basis. They planned a survey, and it was their questions that they wanted to know. And we had a resident and a coalition member paired up, and the survey morphed through COVID into more of a key informant interview, if you will. So the resident and the coalition member went together, knocked on doors and asked the questions and got feedback. What are the priority areas where we should focus as a community? And we compiled all that information and looked for what are some of those quick wins, so people could see that we're in this, we mean it, we want to work with you. And so creating a Facebook page that is shared by the coalition and the residents to share information, share resources, support one another. That was a quick thing, no cost, that we could put in place, again, to say we heard you and we want to work with you. And since then, I gotta say, like, this has just exceeded our expectations. Residents have said, the food pantry used to be right here and walkable, and now it's moved out, a mile or so down the road, which for someone that does not have transportation and has to lug groceries down this busy state highway, very difficult. That was a barrier. So we were able to work with the food pantry, bring the food pantry to the community council, talk about this need, and the timing was just perfect in that through CARES Act funds, the farmers market and the pantry were able to secure a mobile unit. And the residents said, oh, how amazing would that be if that mobile unit could come to our property. And it does twice a week. The number of families now being served by the pantry has increased. And with that, we're pairing other social services that the residents asked for. So there's textile recycling that they were interested in, where they can look at having some clothing opportunities at no cost. We did a vaccination clinic on site because the residents thought that would be really helpful. There's cooking classes that are offered once a month on site. So you get this produce, now what do we do with it? And those are super popular. And then just with the community council, identifying that we want to create this space where our playground is, where our pavilion is, and we want it to be a place where community gathers and kids play. We actually made a sign that says that, and it is posted. There's new lighting, the kids planted flowers. They have taken ownership of that community. And honestly, our goal is to work ourselves out of a job, right? We're there to support and provide some resources and maybe suggest an infrastructure, but the residents are taking this and owning it. And that is the ultimate goal.
Say this is when we kind of, as a coalition, were able to come together and look at what the difference was between working for and working with, because now we had some concrete, tangible things that we could compare. And so, for example, Amy mentioned the survey. So many times as a coalition, we needed data. And the university was guilty of this too. We need data. And we sought to survey people to know what we wanted to know. Right? And so we created the survey, we implemented the survey. We would basically extract their information to then come back and we would analyze it and make decisions about that without ever really engaging the community. So, now we look at that and say, if we're gonna do a survey, what does the community want to know? Let's come together and co-create a survey so that everybody's getting the information they want, and then let's make sure that we communicate that information back. Another one that we learned was, why did we have certain partnerships? And, before this, our partnerships were about, we need that partner for space to have our meetings or to do an event. We need that partner for money to finance this, that, or the other thing. Or we need that partner because we want their staff to be represented on the coalition. But now we look at partnership very differently, and we look at, a partnership can be a whole community, and it's not just, these isolated folks that are going to come together and stay in their silos and represent their sector, but rather we're going to talk about this in a much more broader way. The other thing that we learned was, if we had this big coalition, we could have invited people from the township or people from PVA to be a representative of their community on our coalition. But in doing that, they wouldn't have had equal participation. And so we're much more cognizant about representation without equal participation. And what does that mean? And what does that look like? We have really had to examine diversity in our coalition and not say, we have this community represented by this person and this community represented by that person, because one person cannot speak for a whole community. We really have to work with the community and not have this representation for a community.
I think, lessons learned are trust building takes time and intentionality, but boy, is it worth it. But having the patience to endure that, having the capacity, making sure you don't get in making promises that you can't keep, because that will dissolve the trust quite quickly. And as we're talking through this, it really requires going at the pace of the community and not having your own kind of personal agenda driving the pace. It takes showing up again and again and again. because I really believe that has made the difference. When our coalition members who have been involved and know these families and know the kiddos from school come onto property, it's a warm welcome. It's, you know, a recognition that, all right, they mean this, right? And so I think that is definitely something that I would say is a lesson learned through this process. Rebecca, is there anything else you would add?
I just think that what you said, Amy, is spot on. And I think for folks that are in prevention work, we are motivated by this sense of urgency to make change. And that can be an obstacle for building trust, and it can be an obstacle of working with a community instead of for. And so it can be hard to do that gut check and like, am I just trying to make progress for my agenda, or am I really with my community and listening to them and understanding what pace it is that we need to build trust and take that time?
We're helpers, we're doers, we want to make a difference. And so it's so easy. And I catch myself going and being like, oh, we've got this program or we've got this resource and oh yeah, here we go. But really, like Rebecca said, it's been that gut check for us. Do I want this or do they want it? Proposing it and explaining it and then putting it in their court to say, what do you think? Is this a good fit? If not, it's okay. We'll work to find something else. But I think that is absolutely critical. The other thing I would add is, and I think Rebecca alluded to that when we were talking about assessment and everything, you know, as prevention folks, the strategic prevention framework is something that we are well versed in and we use in our communities. But what we have found that was very unique, especially to this project, is engaging and working with the community in each of those particular areas. So in the assessment part, in the planning and capacity and implementation and then evaluation, that again, creating more ownership, more buy-in because they've been part of the whole process. And then also recognizing that this is a model that we're really proud of and we think works and can be transferred potentially to other communities, but the strategies and the, you know, pace is going to depend on the community, right? And so we can't just say this works and plant it over here. Again, taking that time, building that trust, getting to understand the readiness of the community is absolutely imperative to success.